Okay, we're here today with Ray and Donna. Ray, do I have your permission to videotape this interview and use it as a testimonial for other people?
Yes.
Thank you. Ray, you and Donna contacted me about a month ago. You were down in Arkansas, I believe. And Donna contacted me, and you were in a lot of pain, weren't you?
No, extreme.
Okay, and you were down there for a trip, I believe. And another doctor down there referred you to me because you live close to this area. Describe the pain that you were in back then.
It's hard to describe it other than saying that it was constant pain in my back and radiating all the way down my legs. It was just very sharp, and I took a narcotic pain medication trying to rid myself of the pain, but it unfortunately took a lot, too many pills to make it work because it was that bad a pain.
It was indeed. When you first came in here, it was very hard for you to maneuver when we started therapy.
Yes.
Now we started some therapy, which is called spinal decompression, and we also used laser. How has that helped you? And we're about a month into treatment and maybe about 4 or 5 treatments, if I remember correct, right? How has that been able to help you?
The pain has subsided almost completely. It's very, I don't even think about the pain. Occasionally it will manifest itself to a small degree, but in no comparison to what it was a month ago.
Okay. Donna, how has he changed?
A lot less pain. He's cut down on his pain pills too.
That's good. Okay. Now, Ray, you've had some strokes. How many strokes have you had?
Let's say around 11.
Around 11 strokes in what period of time?
5, 6 years.
In about 5 or 6 years. So it has really affected the use of the right side of your body, correct?
Yeah.
Okay. All right. Have you noticed any improvement in that at all since we've started the therapy?
Not from the stroke.
Okay. All
I
right.
don't expect any improvement for that.
Okay.
They
All right.
didn't give me any encouragement of my other doctors who've been working with that.
Sure.
Nothing from them.
Now, you have indicated that to me in many different times as we've talked, and I've told you about a new therapy program that I hope to be bringing in the next few weeks. Do you remember talking about that?
Yes.
Okay. And that's called neurofeedback. But today, what we're going to do is I want to do some therapy with you, to some brain-based therapy to see if we can get some type of a change. So what I would like you to do is raise your left hand for me out in front, like so, your left hand. Okay, raise that up for me. And then down. Okay, now raise your right arm like you did your left arm as best you can. Okay, good. All right. Okay, I'm going to shut this off and then we'll return in just a few minutes.